Good afternoon, everyone. My name is Tiffany Simpson-Crumpley. I will be the moderator for today's session. We are the South Carolina Office of Rural Health, the Center for Practice Transformation's Best Chance Network Rural Training Series. The focus of today's topic is got patient reminders, using your EHR or your electronic health record system to build an effective best chance network program. So that's what BCN stands for. Joining me today is my partner in this endeavor and veteran QI coach, LaShonda Pettaway Brown. And our guest speaker for today, we always like to feature outstanding best chance network programs, and we truly believe that peers learn best from one another. So today I have the pleasure of presenting today with Denitra Bovane. She is a data analyst with Singleton Family Health Center. That is a rural health clinic with 2 sites in Orangeburg, South Carolina, as well as Santee. So just a little bit of housekeeping today. Your questions can be entered in the chat box at the lower part of your panel that you should see. If you have a question, you can also click on the hand icon, and we will save our questions to the end so we can move through our presentation. So with that said, let's get started. And I also want to thank you because I do realize it is the lunch hour, and my feeling is that if you're willing to spend your lunch with us, we're going to give you a great presentation today. So thank you for having lunch with us today virtually. By the end of today's presentation, we'd like you to have basic information about the Best Chance Network, the building blocks of implementing an effective best chance network program. And the most important aspect of this webinar is whether you are implementing the best chance network program or you are going through the patient-centered medical home program, that patient reminders to come back in the office for health screenings is a core part of quality improvement and good health outcomes. What is the Best Chance Network? Since 1991, the Best Chance Network has been South Carolina's program for the National Breast and Cervical Cancer Early Detection Program. It provides comprehensive screening and diagnostic services for low-income, uninsured, and underinsured women across the state. In the community, it is commonly referred to as the free mammogram program. But we want to highlight that it goes far beyond free mammograms. And a description of services, they provide cervical cancer screenings, and if there are abnormal test results, they provide coverage for diagnostic services as well as navigating that woman to treatment for positive results for breast cancer and cervical cancer, which is in the pap smear test. Eligibility criteria for the Best Chance Network is that a woman must live in South Carolina. She must be 30 to 64 years old, does not have health insurance or is underinsured, meaning that her hospital only covers hospital care. She has a high deductible, $1,000 or higher, what we refer to as Obamacare or an Affordable Care Act policy. So if she has a high deductible and it does not cover diagnostic services, she qualifies, and she must meet income eligibility requirements. Just to give you just a glimpse of what breast cancer deaths look like across the state, as you can see here that the PD region is the hardest hit for breast cancer related deaths across the state. So we are being very intentional. We want to cover the whole state. We want as many best chance providers as possible. And we want to really focus on these communities in dark pink. So if there are folks on here that are BCM providers, your ability to provide services and us give you the tools to be effective in that is key to not only saving lives, but what you'll learn as we go through this training series is that you can earn revenue for your practices by providing these services.
This is LaShonda. Tiffany, the slides are not showing.
The slides are not showing?
No.
Hold on just a minute. Can you see the slides now?
No. No.
Can you see them now?
Yes.
Yes.
Okay, sorry about that. Technical difficulties. Okay, so where were we? I gave you the basic information about Best Chance Network, information about how breast cancer has hit the PD region is hardest hit, and next to that is the Midlands. And now we're going to talk about, and this is building on, bear with me guys. Okay. So picking up where we left off, last month's presentation, which was the implementing building blocks of an effective best chance network program, there are really four components, and at the end of the day, this is really about putting the patient at the center of not only your BCN program, but all quality services that you provide through your practice. So number one, it must be a practice champion for the Best Chance Network program. While it is not their sole responsibility to implement the program by themselves, that must be the person that is activating patient reminder calls, helping the other members of the team define their roles as well. And then also having a good relationship with your BCN regional coordinator and activating EHR screening alerts and automated patient reminders. That is what's going to get your patient in the office. Hold on just a minute. Hold on just a minute. I am so sorry. LaShonda, can you hear me?
Yes.
Okay, do you see your slide?
Yes, I see myself.
Okay, wonderful. So family, we are all family here. Usually we have Andrew Chandler, who is our behind the scenes webinar tech guy, and we don't have him unfortunately today. So please forgive us for the technical difficulties and just bear with us as we roll through the presentation. So I talked about the building blocks of an effective Best Chance Network program, and today LaShonda Pettaway Brown is a quality improvement coach here at the South Carolina Office of Rural Health, and her main goal is to go into practices and help them with their workflow, getting them ready for the patient-centered medical home program, and now helping people activate the Best Chance Network program. So she is a EHR expert. She can go into any system and show you how to activate patient reminders. So she's going to just walk you through the importance of those reminders and just a little bit of information about this wonderful lady that I have the pleasure of working with. She is a Mobile, Alabama native, married mother of 3 children. And also she is a QI coach, as I mentioned before, with the Center for Practice Transformation, and she has been with us since 2015, not 14. And finally, her background is in quality improvement. She worked for the state's quality improvement organization, and she specialized in the Million Hearts Initiative, physician quality reporting system, as well as helping practices with qualifying for meaningful use. So I turn you over to the able hands of LaShonda Pettaway Brown.
Thanks, Tiffany. I'll go ahead and let you control the slides. The evolution of patient reminders. Being a 70s baby, it's kind of hard to think about when patient reminders begun, but for me, there's no way that I could not believe that patient reminders did not start through heavy transportation, especially through horse and buggy. But then once horse and buggy and home visits for physicians kind of went away, it's transpired into us receiving a reminder letter in our mailbox from the United States Postal Service. By the 90s, we all got those aggravating calls about our appointments for the following day. Now we're headed into the 21st century. We're getting emails. And this is an example of a call that will actually come through while you're eating dinner to remind you of your appointment the next day. Or maybe some type of reminder that's telling you you need to get your eye exam. If you haven't, let us know. We'll set you up. If you have, please still let us know. The next example I wanted to show you is just an email reminder that came through my email box from the dentist. We're now in the 21st century receiving emails and text messages. And this is my actual text message that I received from my doctor about appointment, just confirming. So historically, data has shown that patient reminders and notifications usually help alert patients about scheduled appointments, reducing manpower and workload that are typically needed to remind us of our appointments and performing reminder calls. But studies also signify that when practices use reminders effectively, there's an increase in revenue. And to increase that revenue, EHR optimization is critical to leveraging that, and also for developing and sustaining effective outreach programs. So the first thing I want to talk about is just the change, how healthcare is changing. So within that change, I put two pictures here that's actually fueling the change for healthcare. On the left, we see a woman who has no makeup, hair is not combed, she's wearing glasses, she has just on a plain white tee. But now in the 21st century, if you look at that same woman, she's wearing lashes, she has on nails, she's completely changed her clothes, her hair is combed. Within that just signifies that we have an increase in aging population. We have advances in medical science giving the people the ability to live longer. There's better technology, and there's improved availability of health insurance. The second picture I want to that gives you the idea of what's happening, this big evolving change in healthcare. There's 4 generations workforce that's providing that change, those challenges that we talk about in healthcare. You have your senior who's born from 1920 to 1945. He's telling everybody to write him. You have your baby boomer who's born in 1946 to 1965 who's telling you to call him. And then we have our generation Xners, which that's where I fall. I'm telling you to email me. And then we have our generation Y, which is also telling us to text message me. So with that evolution comes change. And with that change, we really have to think about how can we stay current and stay prepared with this evolving healthcare system. So how do you do that? You do that through strategic planning. And here are some questions that you may want to take to your team when you're talking about building reminders and talking about how can you stay current, how you want to deliver and provide effective patient management and patient reminders and notification. So here's a few questions you'll need to discuss with your team. How the patient population wants to be reminded. Do they want to get a letter? Do they want to get a text? Do they want to get an email? How are we going to implement that within our practice to make sure it's effective? What the patient wants to be reminded of. What do we want to remind them of? Do we want to remind them of chronic illnesses or preventive topics that may be customary to them? What's our patient population? Do we want to target the older patients? With that, do we send calls or do we do letters? And the last and well, the next question is, how should the reminders go out? Should we do it on Facebook? Should we use our social media? Should we go on Twitter and send out reminders? Should we send out text messages? Is it going to actually hurt our population because they don't have the data span within our area to accommodate text messages? Does the patient have to pay for text messages? So those are the things that you really need to think about when you're implementing patient reminders and notifications. How often should this information go out? Should it go out once a month? Should it go out every 6 months? Every 3 months? You really have to discuss these items again with your team to figure out what is the best strategy for us to take as a practice. And how should we protect the PHI for patients? Do you want to send a letter with an old address that has not been updated within the last year? Those are really things that you need to think about when you're planning for patient reminders. So once your team develops a plan, how do you implement that plan and get the most out of your current EHR? Just recently, I was in a practice that has eClinicalWorks. Within that practice, they had all different types of what they call campaigns. They're actually health reminders and notifications. Within those reminders, as you can see, they have a yearly visit reminder, a pneumonia vaccine reminder. They have a breast cancer screening reminder and notification. They also have cervical cancer screening reminders. So these are all reminders that are needed within a practice, that are aligned with your BCN network and also aligned with your Wise Woman program. So within this particular practice, as I say, they have campaigns. It's what they call it. And it goes through different formats, different times. You can set it up. You actually have a dashboard where you can see how the measure is actually being implemented. And within that implementation, within the actual system, Tiffany, you go to the next screen. You can see, so this is to the left, we have its breast cancer screening time. This is an actual patient portal reminder that goes out to all patients that have been identified of not having a breast cancer screening within that year. So it goes out in different formats. So this is the first one. So if you don't go into your email and click and actually look at the email, it goes on to send you a text message. So if you don't open the text message and read it for a certain period of time, and I think it's seconds, it'll go on to give you an actual phone call. And the phone call strip is located on the screen over to the right at the bottom. If you do not pick up your phone, it actually leaves you a voicemail message. And you can actually see the information that is left during a voicemail. So within that, this practice actually, everything is automated. There's nothing that they have to do manually besides set up the actual reminders. I know a lot of people who may be logged on may not have ECW, but I wanted to give you an example of what you could potentially do with inside your own EHR. Next slide. So within this practice, they're actually able to measure their campaign for breast cancer screening. As you can see, there were 990 unique patients reached by this campaign. Out of that 900, you had 400 that were over 54, 300 that were between the ages of 40 and 55, and close to 200 that were between the ages of 36 and 46. One of the unique things that I really like about this actual product is it'll tell you the actual failure rate and success rate for emails, messages, text messages, and voicemails. And this information is located to the lower left corner. But it also tells you your success rate and your failure rate. So within that, there was 84.6% that was actually successful and 15.5% that was actually failure. So when you create these reminders and these notifications, you really have to look at what is the best option for my patient population. How can I create a program that's going to be effective and successfully, and that's going to actually get our patients in to see us, that will turn and increase patient outcomes and also increase revenue for the practice.
Thank you, LaShonda, for your wealth of knowledge and sharing those practical tips with the audience today. LaShonda, your example, was this a free or low-cost example?
It was a combination of both. They actually pay for the text messages, and they also pay for the voice and live phone calls, but they do not pay for the patient portal communication piece of it.
Okay. So again, we are not selling ECW as a product, but we wanted to let you know what's available in your system. It may look slightly different. So practically speaking, within the next 24 to 48 hours, if you don't know where to locate these things in your system, number one, carve out time to call your EHR vendor, whether they can walk you through it over the telephone, or if you've invested in on-site technical support where they can send a representative to work with your practice champion to walk through this process. Once you set this process up, you can use it for multiple screening and reminders, as LaShonda so wonderfully demonstrated. Now we're going to keep this train rolling, and I have the pleasure of introducing Denitra Bovain. She is the Data Analyst and Quality Improvement Coordinator at Singleton Family Health Center in Orangeburg, South Carolina. It is a rural health clinic. They also have another site in Santee. And she is a native of Orangeburg herself. She's a proud veteran of the U.S. Marine Corps and a graduate of Claflin University. I turn you over to the able hands of Denitra Bovain.
Good afternoon. My name is Denitra Bovain, and I will be speaking to you about creating and sending electronic reminders. So advancements in healthcare information technology have made it possible to improve quality and efficiency through the use of effective patient engagement in the primary care setting. One of the ways in which this is best utilized is through the use of electronic reminders for not only office appointments, but also for preventive services. I implemented the use of electronic message reminders for preventative service like mammograms for our practices. Electronic mammogram reminders are sent quarterly throughout EHR, and it's a good idea to have your reminder messages typed and saved in the Microsoft Word prior to creating the reminder in your EHR. Our practice uses eClinicalWorks. However, regardless of which EHR your practice uses, it's very simple to enable a reminder message campaign. The best course of action is to call and request information and a demo about messenger campaigns. Most EHRs will allow you to customize your message to fit your individual practice's needs. This allows your practice to fully engage your patients in taking proactive and preventive healthcare actions. Can you switch the slide, please? And go again. All right, so go back.
Here?
Right here, yes ma'am.
Okay.
Right. So this is yes ma'am, it's a screenshot in eClinicalWorks, and in this one I have already set up the reminder. But it's really simple if you have eClinicalWorks. On your left-hand side, what that's called is a band. You will click where it says registry, and then you will come down and it will say look up encounter. And then this screen pops up. Down at the bottom of the screen in the right-hand corner, it says blast e-messages. When you click that, this box will pop up. So in there, I copied and pasted my annual mammogram reminder, and I put it in here. So once you do that, you want to save your message before you send it in the event that you want to use it again later. So you click Save As, and then you type in an appropriate name for your mammogram, for your reminder. When you want to come back for it, it's exactly the same steps with a little twist. So you will go back to registry, you'd click Look Up Encounter, you click Blast e-messages, and where you see there's a little box where it says templates, load, save, and save as, you would click load. The box will appear with every template you've ever saved. You choose the one that you want, and then the box will pop up with your message in it, and you would click send. Now, the reminder messages will be received by all patients who are web-enabled. You can go to the next slide, Ms. Tiffany. This means every patient with an email address on file, a patient portal account, and or a Helo app account will receive the messages. If your practice uses a patient portal, it is also a good idea to place a portion of the reminder message within the welcome message of your patient portal. To maximize our ability to reach our patients electronically, it is required to enter an email address when creating a patient record. If the patient does not have an email or does not want to provide an email, the not provided box must be checked and a reason from the drop-down box must be selected. To ensure our office staff complies with this rule, I contacted our EHR provider, eClinicalWorks, and instructed them to add email address to the mandatory fields. This means a new patient record cannot be saved until the email address field is completed. For established patients, if the email address is not on file, once the record is open, it cannot be closed until the email address field is completed. The only way you can have a patient portal for us with ECW is to have an email address. That's the reason why we have it that way. When our patients come in to show them how their patient portal works, I usually have them sit down and I'll walk it through them step by step so they'll know exactly where their reminders will be. Right? So once you send it, would you go to the next slide, Ms. Tiffany?
Before you proceed to the next slide, for the participants on the call, what if you have a patient that doesn't have an email address? How do you address that challenge?
Okay, so we also have the voicemail campaigns that come out. They send, when you go in there, like when LaShonda was there and she showed you the campaigns, you can set the parameters for which one you want. So if you want to target women between ages 40 to 65 who do not have haven't had a mammogram within the last year, you click the button and then you send it out and it goes to their phone. They'll get a message that way.
Okay, thank you for answering that question.
Yes, ma'am.
Okay.
Another thing we also do. Yes, ma'am. No, you can go to the next slide. It's not a problem. And they can ask questions. One of the other things we do, well, I implemented since I've been here, is we do have a Facebook and we do have a Twitter. So once a week, I will go in and I post on there these types of reminders as well. We are also working on getting a YouTube channel. I am a Generation Y. We do a lot of social media, but the thing is, a lot of baby boomers are into social media as well. My mother is a patient here. She uses the patient portal. She thinks it is the coolest thing when she gets that ding, because it makes a little ping noise for you when you have that patient portal to let you know that you have a reminder from the doctor's office. But as I was saying, one of the things you should also do if you're using patient portal is to take a portion of that message and put it in your welcome address. So right there where the pink box is around, that's the last portion of the message that I sent to them, right? So that gives them a reminder as well. And if you look down in the bottom, it's circled in pink. It says messages. The new message is your annual mammogram reminder. So they get it like a double in your patient portal. You see it in your welcome message. And then you also see that you have a message there as well. So if you go to the next slide, please. This is what the actual reminder looks like in the patient portal. It's telling you that where you should have your annual mammogram, and if you haven't had one this year, to schedule one. But the also thing is to remind the other women in your life to have a mammogram as well. We make it as easy as possible for our patients. We do a quarterly mobile mammogram unit that comes out, and if the patient responds and says that they want to do the mobile mammogram unit, then the unit comes to our office. They will park in the parking lot, walk up to the mammogram unit. I'll walk them in, and they have their mammogram done right then and there. The results are usually sent to us from the mobile mammogram unit by the end of the day or the following day, depending on what day of the week we have it on. So like I say, we're doing it quarterly. The next one we're doing is in May, and the very last one will be in October to celebrate Breast Cancer Awareness Month. Electronic reminder messages are highly beneficial for both practices and patients. They enable practices to eliminate wasteful and expensive paper-based mailing campaigns. Additionally, it assists your practice in meeting specific criteria like sending and receiving secure messages. Studies have shown if electronic preventive reminders are fully integrated into your practice's workflow, it has the potential to improve the receipt of overdue testing. However, creating and sending electronic reminders alone is not enough to fully impact your patient population. It requires that designated office staff members be fully engaged as well. This means you should track which messages are successfully and unsuccessfully delivered to the intended recipients. Ensure your front desk staff verifies the personal information in your EHR for the patient is correct. One incorrect character will determine if your electronic reminder is actually received. And that is it.
Thank you, Ms. Denitra. I always like to summarize, and you really provided some juicy nuggets for our audience today. One of the things that she mentioned was this whole idea of having a Microsoft Word document with your wording, your content for your campaigns, and having that saved. Secondly, if at all possible, collecting an email address from a patient. If they don't have an email address, making sure you have a reliable number so you can do a voicemail campaign, and really just building on meeting that patient where they are and what's the best way to communicate with them. She also talked about using Facebook and Twitter and YouTube and really using social media to engage your patients as well. So I really hope that you can take some of these things and implement them in your practice. And we're going to keep rolling and get to the Q&A session. So be thinking about what you want to ask. Please enter your questions in the chat box. So why are we doing all of this? Number one, our partnership with the Best Chance Network, our end goal is to make sure that our existing rural providers have strategy around getting women into their practices screened, and not just screened, but if those tests come back positive, Best Chance Network provides funding for the whole continuum of care, and your practice is reimbursed for those services. So I want to highlight that as well. So when that woman, uninsured woman, walks into your office and she is 30 to 64 years of age, there's still an opportunity to serve her and be reimbursed for it. So that aspect. If you build this foundation for the Best Chance Network, activating your patient reminders in your EHR, pulling reports so you can see how many women are due to be rescreened. All of these things are setting you up to be certified as a patient-centered medical home program, meeting the mark with your HEDIS measures so you can be better paid for your Medicaid eligible patients, for the physician quality reporting system. All of these things align really well. So while it may be some initial work in the beginning, it's going to set you up better to be paid through value-based reimbursement methodologies. Finally, you may start off with the Best Chance Network. That will be her point of entry, but you have the opportunity to build a relationship with that patient, provide a holistic services. I'll be talking about Wise Woman in just a minute, in terms of really looking at how she's managing her weight, her blood pressure, and be reimbursed for that as well, and to keep that patient at your medical home. Again, specifically these opportunities, activating patient reminders, these are some of the examples of this activation qualifying you for PCMH standards, also meaningful use, clinical quality measures for cervical cancer and breast cancer screening. So it's a slam dunk across multiple quality improvement efforts in your office. In terms of HEDIS measures, Medicaid MCOs pay their providers on how well they're doing on these measures. So again, if you're implementing the Best Chance Network, you're already hitting the mark to do well and be paid optimally by your contracts that you have with the different Medicaid MCOs. Finally, with MACRA coming on board and merit incentive-based payment systems, this also helps you with a payment adjustment of -6% to 8% depending on how well you do. So just really want to highlight that as well, in terms of if you build the foundation for one, it builds a strong house in your practice, a strong medical home to provide high quality services. Now what? So we've had all this talking and sharing tools and tips with you. So what is the call to action for you? For our existing BC, if there's someone on here, or folks on here that are not signed up as a Best Chance Network program, please get signed up with Trinessa Jones. Her information will be provided, and they will activate. And then those who are currently Best Chance Network providers and you have some prior authorization codes, you can use them and be reimbursed for providing services to your women. Most importantly, if you don't have a key staff person to be the coach or the practice champion for your practice, that is critically important. There needs to be one person like Denitra that is responsible for getting the team involved, activating those reminders, activating the front desk, that when that patient comes in, have you had a mammogram? Did you know about the Best Chance Network program? Everybody has a role in serving these women in your practices. So designate a practice champion within the next 24 to 48 hours. It does not necessarily have to be a clinician. Usually it is a front desk staff person, a data analyst like Denitra, or even a medical assistant. So if you don't have that, get that done within the next 24 to 48 hours. Ensure that your EHR has a template for screening reminders, which most of them usually do. And if you don't know how to use it, that's what you're paying your vendor for. You call them, and as Denitra said, she called her vendor and had them walk her through what is called a demo messenger campaign to activate your patient reminders, and really just setting up your foundation for that. So that's what you're paying for. So engage your EHR vendor in helping you walk through that process. And also, LaShonda Petaway Brown is available to visit your office and sit with you. She's probably going to shoot me for saying that, so I apologize in advance, LaShonda. But that is the example of the type of technical assistance that is available through our Office of Rural Health. And I'll be providing everyone's information at the end of the presentation. Determine the workflow practice that works for you. We also do workflow observations when we come into your office and watch how the patient moves through a typical appointment, and give you tips and tools just to be more efficient in how you weave these healthcare improvement programs into your practices and make it more efficient. In the previous webinar, we provided tips and tools. If there are things that Denitra shared, we are really big on rip off and duplicate forms that work for your staff. In the last webinar, we had a clinician cheat sheet in terms of when you have that Best Chance Network billing form, what are the most critical information that needs to be on that form to be paid, so we can make that available to you. Establish and maintain a relationship with your Best Chance Network regional coordinator. For smaller practices, consider using student interns from local technical colleges. We realize that many of you have 3 to 4 full-time positions and really challenged with trying to implement all of these different healthcare improvement programs. So if you need an extra set of hands, this is a wonderful opportunity to use free support from your local technical college, so CNA interns, medical assistance interns, and this is a very rich learning opportunity. So if there's a community college in your area, consider partnering with them to receive student interns to help you with your work. Finally, if you are a Best Chance Network provider, consider signing up to be a Wise Woman provider as well. What is Wise Woman? Since 2008, DHEC has offered the Wise Woman program to reduce factors for heart disease in low-income women 40 to 60 years of age. Services include cardiovascular disease screening, health coaching, and lifestyle changes with a focus on controlling high blood pressure. And you must be a Best Chance Network provider in order to provide Wise Woman services. And you might ask, why are these services offered as what I refer to as the dynamic duo? Research shows that there is a clinical connection between hypertension and obesity, and the risk factors for developing cancer later on in life. So because of the clinical connection between these chronic diseases, we like to offer these services. So again, you're looking at an opportunity to be reimbursed for Best Chance Network services, but to address that woman's holistic needs in terms of uncontrolled high blood pressure, if she's struggling with her weight. These are all services that are paid for. Providing health coaching. You can be reimbursed for 3 health coaching sessions to help a woman get her blood pressure under control. And that's separate from Best Chance Network. So just reiterating the requirements for Wise Woman. You must be a Best Chance Network provider already. You must be a South Carolina resident. The woman must be 40 to 60 years of age, so that's a slightly different requirement than Best Chance Network. But if you have a woman that needs both services and they fall within this age range, you could potentially be reimbursed for Best Chance Network services and Wise Woman services for women 40 to 64 years of age. The woman must not have health insurance, or if she has a high deductible plan through the Affordable Care Act, or what we refer to as Obamacare, and it's over $1,000, or it doesn't cover diagnostic insurance or only hospitalization, she qualifies for the program. And that woman's income must fall below 200% below the federal poverty level. So now I am going to open it up for questions. If you have any questions, please put them in the chat box or raise your hand and I can unmute you. Let's see. So LaShonda has said that she can help, and I mentioned that previously, that she can help the practice that does not have eClinicalWorks. So if that sounds like you, feel free to contact our office. If we happen to have folks from out of state, I hope that this information has been germane to you wherever you are, with the exception of state-specific material. Activating patient reminders can really be helpful, again, of building that strong quality improvement foundation in your office and setting you up for better reimbursement. Are there any questions? I don't see any hands. Let's see. I see Joanne Gersten. Joanne, can you hear me?
I can. Can you hear me?
Yes, ma'am. What is your question for us today?
I typed it in, so I'm the one that asking for the, first of all, excellent, excellent. I'm in New Hampshire.
Okay,
Excellent.
wonderful.
Oh, wow.
And can you guys send the participants the slides, and also on your office assessment, the process assessment, any tools you have for that? I was asking for.
Most
Because
definitely.
we like to beg, borrow, and steal up here too.
Wonderful. So yes, the slides will be made available, and this session is being recorded. So you should receive a follow-up email from GoToWebinar of the webinar recording. So yes, we can definitely provide those resources for you. Anything else we can do for you today?
So, thank you very much.
Thank you, Joanne. We really appreciate you participating. Are there any other questions? Okay. So this is definitely not the first or last opportunity to connect with us as a team. We will be doing a series of more trainings, but some actual reminders for existing Best Chance Network providers. So South Carolina DHEC is closing out a CDC grant. So this initiative is funded by the Centers for Disease Control. So because they are closing out this grant, they are asking that you submit all outstanding claims by June 19th. And so you can ensure being paid for those services. Also, that gives you time to correct any mistakes that are on your forms. So the message here is do not hold your claims, because you risk not being paid. And I know everybody wants to be paid. So June 19th is your deadline. And as always, we are here to help. In addition to the team at South Carolina DHEC, at the Office of Rural Health, we do have staff, quality improvement coaches that can provide on-site support for transforming your practice. And some of the examples of the technical assistance that we provide is helping you if you're interested in becoming a patient-centered medical home. We walk you through becoming certified for that process. The Best Chance Network and Wise Woman program, helping you with on-site TA with that, so you can streamline your workflow process so a woman is receiving seamless services and it's not double work for you, for lack of a better way to say it. Macro technical assistance. We also have support for rural health clinics. For those of you that don't know, being designated as a rural health clinic provides you with enhanced reimbursement for being a rural provider. We do provide regulatory compliance to make sure that you continue to receive that optimal reimbursement rate. We have experts with coding and billing advice to maximize revenue for your practice. So please take advantage of those resources. And how do you get in contact with us? Trinessa Jones is the Best Chance Network Director. If you are interested in becoming a Best Chance Network provider, please email her or call her. Linda Pecori is the Wise Woman Program Manager. So if you're already a Best Chance Network provider and you want to add this as a complementary services, again, that dynamic duo for that self-pay, that uninsured woman, and be reimbursed for the services that really you're already providing, please contact Linda. This is her email address and her phone number. And my name is Tiffany Simpson-Crumpley. I'm a QI coach, but I specialize in education and training for rural health provider staff and providers. And last but certainly not least, LaShonda Petaway Brown. She is your on-site person that can come and help you go into an EHR and build your patient reminders and really help you set up a good foundation for not only Best Chance Network, but meeting other quality improvement measures. And finally, I'd like to thank Denitra Bovane for lending her time today and her expertise. And at the end of this presentation, you should see an evaluation pop up. We truly believe that if you knew better, you could do better. And so please give us your feedback in terms of what we could do better, topics you would like to see for next time. And I will we'll be having trainings next month, so be on the lookout for that as well. Thanks so much for joining us today, and we will see you in April. Just to give you a preview, we're going to be doing some front desk staff specific training around these type of patient engagement measures, and we're also going to do a billing specific training in the month of April. So be on the lookout for announcements for that as well. Be well, and thanks so much for having lunch with us. Any other comments from our presenters?
No.
All right.
No.
Thanks for joining us, and see you in April.